Hello and welcome to Pessima's Healthy Tips. For today's lesson, we are going to be delving into hepatitis, which of course is the inflammation of the liver. There are 5 types, which are the hepatitis A, B, C, D, and E. So we are going to delve into these types. General causes of hepatitis are broadly categorized into 2, which are the acute and the chronic causes. Of course, the acute hepatitis involves the viral, non-viral, alcoholic, toxin, drugs, autoimmune, metabolic diseases, and also ischemic hepatitis. These are what causes the acute ones. Now, the chronic causes includes viral hepatitis, alcohol, drugs, non-alcoholic, steatohepatitis, autoimmune, and heredity can also cause the chronic hepatitis. Now, what are the viruses that mainly cause this hepatitis? The viruses that are involved in hepatitis, which are the hepatitis virus, the cytomegalo, Epstein-Barr, herpes simplex, and varicella, entero, rubella, adeno. These are all the viruses that are included in it. Now, for the pathophysiology, how does one contact the hepatitis? Of course, the virus invades and it stimulates the local degradation, and also necrosis occurs in the liver. Subsequent infiltration of parenchyma cells occurs, and inflammation. After that, inflammation occurs, and after the inflammation, we have the biliary obstruction, which is wherein we have the obstruction in the biliary layers. So, upon this obstruction, there are structural changes in the parenchyma cells. There will be structural changes which will lead to altered liver functions. Impaired bile excretion now because the build-up of bile in the blood, urine, and skin, which lead to the elevated ALT, SGPT, and ALP, which decrease albumin synthesis. Now to the types of hepatitis. Of course, as you mentioned earlier, there are 5 types: A, B, C, D, and E. Now we are going to talk about them in detail. Starting with hepatitis A, which is the forefront. Of course, its modes of transmission is through close personal contact, contaminated food or water, and also blood exposure, which is rare. Although it's another mode of transmission, but it's rare. That means it doesn't usually occur as to the previous ones. Clinical features include incubation or preclinical periods, which range from 10 to 50 days. Pre-icentric phase, of course, which range from several days to more than a week. It shows symptoms like loss of appetite, fatigue, abdominal pain, and many other symptoms which emerge after those fatigue and abdominal pain. Of course, now we see also about the isoteric phase. Of course, after the pre-isoteric phase, we have the isoteric phase, which is a position where jaundice develop, and as jaundice develop, total bilirubin level exceeds 2 to 4 milligram per deciliter. So this is where the problem will arise. The isoteric phase generally begins within 10 days, of course, of the initial symptoms. After the isoteric phase, we have the convalescent period, wherein disease is slow but the patient recovery uneventful and complete. Of course, necrosis of the liver to the first 6 to 8 weeks. Necrosis of the liver occurs. High fever, abdominal pain, vomiting, jaundice. These are all the things that happen in the convalescence period. Now for the diagnosis, how do we find them? Of course, we use the IgM in the serum. We find the IgM in the serum of patients. Also the IgG, immunoglobulin G, and immunoglobulin M. For the prevention, we should of course have a shot of the immunoglobulin for 2 weeks after exposure, and good hand washing, cook food well, and all the other hygienic procedures must be undertaken. For the treatment, for some hepatitis, there are no medicine or treatment to make it go away. Rest, fluid, treatment of symptoms are what will be more productive in some cases of the hepatitis A. Now we delve into hepatitis B. Of course, hepatitis B The mode of transmission is through unprotected sex, with person in contact with the virus. It also can occur through sharing needles, of course, and mother to child, that is teratogenic, and many other forms as we have seen in the earlier slides. For the clinical period, we have the incubation period, which lasts from 2 to 6 months, which shows symptoms of fever, fatigue, loss, just like the hepatitis A. Now, for the prevention, we have vaccination. Of course, there are vaccines available for hepatitis B. We also have the hepatitis B immunoglobulin, which will be given within 48 hours of incident. Other measures also will be undertaken, like the screening of blood donors, and also the blood and blood flow precautions must be taken into consideration for proper treatment. Now, for continuation of the treatment, we have two approved therapies, which are the interferon and lamivudine. These are the viral medications that we must, according to the healthcare providers, should be taking. The interferon and the lamivudine, these are the most active ones to be taken in hepatitis B. Now, for hepatitis C, which is more or less liver infection caused by a virus, as we all know, and it's also known as a non-A and non-B hepatitis. That means it has no relation with A, neither with B. As you can see from the structure, this is what an hepatitis C virus looks like. With its nucleocapsid and single-cell RNA, this is what it looks like. Now we go into the mode of transmission. Of course, how does it transmit from person to person? It's through injection, drug use, sharing needles, receiving blood or blood product, infected mothers to child, teratogenic, and also unprotected sex. For clinical presentation, the incubation period is from 2 to 26 weeks, which follow symptoms with fatigue, malaise, jaundice, nausea, itching, poor appetite. These are all the symptoms that we follow during the 2 to 26 weeks as seen in the laboratory. And now for the treatment, also we indulge in interferon and ribavirin, which are antiviral drugs. Of course, the suggests 40% cure rate upon consistent taking. Now, how to prevent this hepatitis C? There is no vaccination. That is true. There is no vaccination. You only do not share needles, orange water, wear protective equipment. Also, do not engage in unprotected sexual contact. Unprotected sexual contact is becoming one of the major causes of hepatitis. Now we go to hepatitis D. Of course, its nickname is Delta virus. Of course, it's Delta. So if you want to remember this virus, just be making it into mnemonics as Delta. Now, what is the mode of transmission? Percutaneous exposures, yes, for the bones, injection drug use, premucosal exposure, and also sexual contact. So abuse and also sexual contact appears also here. Now, for the clinical features, to treat co-infections, severe acute diseases, and low-risk chronic infections or co-infections. Now, for superinfections, usually develop chronic HDV, hepatitis D also. Now, prevention. How do we prevent? Now we continue with hepatitis E, which is of course one of the major hepatitis. So we have A, B, C, D, and E, which is the last one we are going to be talking on today in today's lesson. Of course, its mode of transmission is from person to person. We have fecal oral route, and it can also be transmitted through contaminated drinking water. Pure drinking water. That means you need to be very cautious of the water you drink. Now, for the clinical presentation, the incubation period ranges from 3 to 6 weeks with a mean of 40 days. That means within 3 to 6 weeks, you have to see it in the laboratory. Now, for the prevention, there are no vaccines at present, so you need to be very careful. But good personal hygiene, high quality standard for public water supplies, and proper disposal must be put into consideration. Now, for the clinical features, also we have something like flu-like symptoms, jaundice, fever, nausea, decreased appetite, not feeling well all over. Also, abdominal pain or discomfort can occur for hepatitis E. Of course, as we have earlier seen that it has no vaccine, so we need to be very careful with hepatitis E as well. Clinical features continues with such as diarrhea, joint pain, sore muscles, itchy red eyes on skin, of course, clear colored stool, dark urine. Now, what are the diagnostic measures that we need to put in place, or how do we find them in laboratory? History collection, physical examination, blood tests, CT scans, magnetic resonance imaging, liver function tests. These are all the tests that we need to perform in laboratory to see it. Now, for treatment, with supportive care, medication, avoid alcohols, hospitalization, liver transplant, all of those things we need to put in place. For the nursing management, we need to do early detection and recognize the chronic liver disease. With support monitoring, also we need to prevent the spread of the infection. We have to maintain adequate nutrition, also promote rest and comfort. That's the sole aim for the patient. Thank you for watching this far. Well, of course, once again, don't forget to subscribe and share the video. Thank you.